Hola, muy buenos días.
Good morning or good afternoon to all, and thank you for connecting to this press briefing on the COVID-19 pandemic in the region of the Americas. My name is Sebastián Oliel with the Communications Department at PAHO, and this session will be about an hour long. As every week, we have already received your questions through the Q&A button. Please remember to include your name and media outlet when sending your questions. Let me remind you that we have simultaneous interpretation into English, Portuguese, and Spanish, and you can choose the language through the interpretation button. Today, PAHO's director, Dr. Carissa Etienne, will be reporting on the situation of the pandemic in the Americas and will be providing an update on vaccine access in the Americas. Together with Dr. Etienne, we have Dr. Jarbas Barbosa, PAHO's Assistant Director, Dr. Ciro Ugarte, who is the Health Emergencies Head, and also Sylvain Aldigueri, Incident Manager. Now I would like to invite Dr. Etienne to share her opening remarks.
Good morning and welcome to our press briefing. Thank you for joining us today. Before we start our briefing today, I have to acknowledge the event that unfolded this morning in Haiti, leading to the untimely death of President Moise Jovenel. PAHO wishes to extend its condolences to his family. We also want to express solidarity with the Haitian people in these uncertain times and to reiterate our commitment to advance the country's health and development. Our organization has a long history of working in Haiti hand in hand with local authorities, health professionals, and communities through our country office in Port-au-Prince. We continue to stand with them now and will redouble our efforts. One of PAHO's top priorities over the past few weeks has been to support Haiti to start vaccinations and to control the transmission of COVID-19. We will continue working towards this goal with global and local partners. I am hopeful that the arrival of vaccines in the country can start to turn the tide of the pandemic and bring some relief to the Haitian people during these very difficult times. This past week, we have had 1.1 million new cases in the Americas, a small decline in relation to the previous week. And while mortality has also been reduced in this period, our region is still reporting over half of the deaths registered globally. This is a clear sign that the toll of the pandemic in the Americas continues to devastate families and communities, even as parts of our region are experiencing some relief. In North America, while the overall trends are declining, there are areas in which transmission is still rising, such as Baja California del Sur in Mexico and Yukon Province in Canada. In Central America, there is a rise in overall cases in Belize, El Salvador, Honduras, and Panama, as well as in some areas of Guatemala. In South America, Brazil, Colombia, and Ecuador continue to report a high number of new cases, while incidence has been reduced in Peru and Bolivia. It's been encouraging to see that all 4 countries of the Southern Cone registering less cases over the past 2 weeks. In the Caribbean, Cuba is reporting the highest number of new cases per week since the beginning of the pandemic. And Trinidad and Tobago is facing increased mortality due to COVID-19. The diversity and inequity of our region continues to be reflected, not only in the trends of the pandemic, but also on how countries are able to access vaccines. There is progress in vaccinations in the Americas, but alas, not for all. 1 in 4 people in our region have been fully immunized, and over 600 million doses have been administered in the Americas. However, over half of these doses have been applied in just one country, the United States. We must celebrate that a nation that has been so heavily impacted by the pandemic was able to turn the tide. But we can't close our eyes to the stark inequities on vaccine access. Several other countries have done a remarkable job in vaccinating their people, like Chile and Uruguay, who have around 50% of their population fully immunized, and Canada has covered over 30%. But for every success, there are several countries that have been unable to reach even the most vulnerable in their population. Millions of people in Latin America and the Caribbean still don't know when they will have a chance to be immunized. Haiti, for instance, has yet to start vaccinations. Jamaica is also struggling to access enough vaccines to cover their high priority groups. Some countries in South and Central America, where the pandemic has hit particularly hard, have not yet been able to access enough vaccines to fully vaccinate 3% of their populations. The 24 million doses of COVAX deployed in the region so far have been quickly put to use, and countries are eager for the additional allocations to ship as soon as supplies are available. Our countries know how to deploy vaccines and are ready, but they need more doses, and they need them now. And that's why PAHO has urged nations with enough vaccines to share them with countries in the Americas that are still struggling. And that call is starting to resonate. This week, El Salvador welcomed 1.5 million new vaccine doses from the United States government through the COVAX facility as part of the pledge to share at least 20 million doses to our region. Others are receiving additional donations of doses bilaterally. Bolivia is due to receive just over 1 million doses this week, and other donations are being prepared. PAHO is leading the logistics for the delivery of the COVAX doses. And we've been working with the US government, the COVAX facility, and recipient countries to make sure that all requirements are met and that vaccines can quickly and safely arrive at their destinations. While we applaud the United States government, we also applaud Mexico's donations to several countries in Central America and Jamaica. Regional solidarity will help pave our way out of this pandemic. In fact, those donations are helping COVAX substantially expand the availability of vaccines in the next round, with some 60 million doses coming from the United States and over 11 million from Japan, contributing to the expected allocation of some 143 million doses by COVAX. While we must rely on donations in the short term, we are already planning for a future scenario in which more supply will be available. PAHO is mapping the demand deficit from our member states to determine how the revolving fund can support countries to meet their future goals with COVID vaccines and other supplies, such as syringes and cold chain equipment. we need to reduce inequality in vaccine access. Our job won't be done until we have reached every eligible person in every country, regardless of where they live, their ethnicity, or their income. We must be guided by evidence and equity as we deploy these vaccines. So I wish to remind you of a few things. It is not yet time to roll out boosters when millions have yet to receive one dose. 1, 2 shots and 1-shot regimens have proven effective long after they're administered, and sticking to them will allow us to protect more people. We should ensure that those at greater risk, like health professionals and the elderly, are protected everywhere before rolling out limited doses to healthy children. Vulnerable populations, such as migrants and indigenous groups, should be prioritized with programs that take their needs and the culture into account. COVID-19 has taught us that when some are left behind, all of us are at greater risk. The vaccines that we have at hand work remarkably well and will help us overcome the pandemic, but only if we take this opportunity to address the challenges that have long held us back, especially the pervasive inequality in access to health. Fair and broad vaccine access must be the first step in this process. Thank you.
Muchas gracias, doctora
Thank you
Etienne.
very much, Dr. Etienne. We will now move on to the questions and answers. We have already received some via email and also the ones we are receiving through the Q&A. Please remember to include your name and media outlet when sending your question. The first question has to do with the Delta variant, and this is sent via Lina Diaste from AFP, and in English it reads,
Driving COVID-19 cases worldwide. How concerned is PAHO about the Delta variant in Latin America and the Caribbean? In the US, Delta has become predominant. Can the same thing happen in other countries in the region? Doctora Etienne.
Let me thank you for this question. Although the Delta variant has already been detected in 15 countries or territories in the PAHO region, so far it has been mainly associated with cases in travelers. Community transmission of the Delta variant continues to be very limited, while other variants continue to predominate. It is difficult at this time to predict what the impact of the Delta variant will be in our region. Other variants, such as the Alpha, for example, which also has a high transmission capacity, were only temporarily predominant in few countries. Then these were quickly replaced by others, such as the Gamma variant or the Lambda variant of interest, also known as C37. We know that the Delta variant has been increasing in the United States of America, and it is becoming predominant in some states. Nevertheless, distribution of variants has been always different between countries in the region, with predominantly very heterogeneous and different distribution patterns. So therefore, the situation in the United States of America cannot necessarily predict how this variant is going to affect other countries. So for this and other reasons, it is important that control measures in public health should be focused on reducing the transmission, regardless of the variant that circulates. We must use all the available tools that have been shown to maintain their effectiveness, including the proper use of masks, social distancing, and of course, vaccination and other measures.
Gracias, doctora Etienne. Siguientes
Thank you,
preguntas.
Dr. Etienne. The next question is by Francisco Morere from Cover News in Argentina and Mrs. Alvarado from Newsday, Trinidad and Tobago. Francisco is asking, what is PAHO's recommendation for the eventual combination of vaccine doses from various laboratories, since this is being analyzed in some countries given the lack of some second doses? And Mrs. Alvarado is asking, how long should a person wait after administering the first dose and then becoming positive to COVID to receive the second vaccine, in this case, the AstraZeneca vaccine? Dr. Barbosa, thank you for these questions. First, in connection with administering different vaccines, several studies are underway to verify whether it is possible to have the first dose of one vaccine combined with the second dose later on of a second vaccine. This could make it easier for some countries to complete their vaccination schedules, but so far there is no evidence that would allow us to recommend administering different vaccines. Some studies have been done, but we need to complete the studies. We need to have a full analysis to be able to present this recommendation. The current recommendation by the strategic group of experts on immunization with WHO and PAHO is to continue with the first and the second doses of the same vaccine based on the recommendation. As to the question posed by Ms. Alvarado, the person has to take the second vaccine, in the case of the AstraZeneca vaccine, within 8 to 12 weeks after the first dose, and also based on the recommendation by the country. Some countries are administering the second dose earlier, within the 8 weeks, to conclude protection faster, and other countries are using the final phase, that is to say 12 weeks, so as to have more vaccines to at least administer the first round, the first dose. Both approaches are fine because studies have shown that the second dose is effective. A person should not get vaccinated if that person is sick, if that person has fever or other symptoms. That is not advisable in the case of any vaccine because that could be misunderstood as an adverse reaction to the vaccine. The person should be in proper health when receiving a vaccine, including COVID-19 vaccines. If there was a positive test, if it could be an antibody test or any test, it is not possible in that situation in particular. But if the person already had COVID-19, this does not change the vaccination schedule. The person has to receive both doses in the case of the AstraZeneca vaccine within the recommended period for the person to be properly protected. Thank you. Thank you, doctor. The next question is by Bennett Roach from the Montserrat Reporter.
Situation continuing and seemingly increasing in our part of the world, why do we still not hear anything about the treatments being used long before ICU is needed, not to mention as well efforts being encouraged for the different treatments available? Dr. Aldighieri?
Thank you for this question from Montserrat. Since the beginning of the pandemic, PAHO has been monitoring and synthesizing the evidence of published and ongoing research on any possible therapeutic options. This report is publicly available on our website and is shared with medical and scientific societies on a regular basis. And it currently contains more than 300 randomized controlled trials regarding 122 therapeutic options. PAHO has also developed evidence informed recommendations to provide guidance on the management of COVID-19 patients at different stages of the disease, mild, moderate, severe, critical. The process to formulate each recommendation takes into account different criteria. First, the assessment of the quality of the evidence of the different publications. Second, the balance between benefit and harms of each intervention. Third, the values and preferences of the patients and users. And four, the feasibility of implementing those interventions, among other aspects. Severe and critical COVID-19 patients currently receive respiratory and hemodynamic interventions, along with therapeutics. And among these therapeutics, corticosteroids. We discussed a lot during this press conference about dexamethasone, anticoagulation protocols, and now with interleukin-6 receptor blockers. And I can mention one of them, tocilizumab, that has been validated by PAHO and WHO during the last weeks. Many other therapeutic options are still under investigation. More evidence is needed to provide specific recommendations on these other options. Regarding mild and moderate cases, there are a number of potential interventions that have provided some evidence of benefits. However, more research is still needed to formulate an evidence-informed recommendation. But very important, and as in many of the questions today and during the last press conferences, we would like to highlight that vaccination and non-pharmaceutical public health measures are key to control the pandemic and prevent the complications of the disease. I hope I have answered the concerns of the journalist in Montserrat. Thank you.
Gracias, doctor. Próximas preguntas.
Thank you, doctor. The next questions are related to Venezuela from Mariana Souquet, Efecto Cocuyo, and also from Mariana.com. And she's asking whether we could update on the COVAX situation in Venezuela. The authorities have requested the shipment of vaccines or the devolution, the return of the funds, while spokespersons for Gavi are indicating that they're working to solve the problems as soon as possible. What is the information PAHO has? What is the status of Venezuela? Have they already paid their debt, and when could they start receiving vaccines? Dr. Ugarte. Thank you for those questions. I should remind you all that in September last year, the Minister of Health of Venezuela signed an agreement with Gavi to receive vaccines through the COVAX facility, and this is under the committed purchase for 5.7 million individuals. In April this year, the government of Venezuela decided not to accept the AstraZeneca vaccine, and they requested to modify the purchase modality for the vaccines to an optional modality, that is to say, what vaccines to accept or not. And that was accepted by COVAX, and therefore, in the same month, the agreement was issued, and Venezuela made an advance payment under this modality. And as it is public knowledge, that payment was made for about $100 million. It is also public that the availability, the global availability of vaccines under the COVAX facility for this purchase mechanism is quite limited globally. And the next round for the deployment of vaccines is being finalized, and it will be informed to all of the countries participating in the facility including Venezuela. The AstraZeneca vaccine is the most broadly used vaccine under COVAX. So given this context, PAHO continues to work very closely and is supporting the process to manage and support vaccine acquisition through external stakeholders with close coordination with Gavi, and we are expecting to have good news for the Venezuelan individuals to receive a sufficient amount of vaccines through COVAX. Thank you.
Thank you, Doctor. The next question is from Janely Vasquez from Guatemala. And the question reads as follows: how much risk does a person with a single dose of AstraZeneca face in contracting any of the variants of the coronavirus? And at a country level, is it better to vaccinate more population with a single dose, or is it preferable to vaccinate a smaller number of people with the entire protocol? Thank you for your question. The vaccines that require 2 doses, and so far we've only had the Johnson & Johnson vaccine that only requires a single dose. All the other forms of the vaccine require 2 doses to achieve full protection for people. So it's important for people who take the first dose to be able to obtain the second dose. They cannot think that they are protected, fully protected with just a single dose. This is not correct. Only by receiving both doses can a person feel properly protected. It's also important to emphasize that when we talk about vaccine protection, this is possible both for the original virus as well as the resurging variants. Now, the person that has been vaccinated should continue to take all the necessary means to protect themselves. No vaccine is 100% infallible, and not just against COVID, against other diseases as well. Vaccines offer very important protections, and we have extensive data, not just from Europe, but the US, and we now have data in Latin America and in the Caribbean regions that demonstrate very clearly the level of protection that vaccines are providing in terms of the number of deaths and the hospitalization rate in many countries. So having both doses is fundamental. And especially in areas where we see a very high rate of transmission, the people who are vaccinated still need to continue wearing masks. They need to continue to avoid these overcrowded spaces, because they would then have the double protection, both the vaccine as well as the protection afforded to them by the various measures that they undertake. This is all very important. Thank you. Thank you, Doctor. The next question is from Ilana Cardial, a reporter from Agência Estado in Brazil.
With the biggest number of deaths caused by COVID-19. How the uncontrolled situation of the pandemic in such a big country as Brazil can impact the neighboring countries? Dr. Aldieri?
Thank you for this question from Brazil. It's important to note that the region of the Americas has a mosaic of patterns of transmission, different mosaic of transmission in North America, in Central America, in South America, and in the Caribbean. It is crucial to reduce transmission not only in Brazil, but in all countries of the Americas, to save lives and to decrease the transmission, including to decrease the community transmission of variants of concerns. Brazil has been through more than 15 months of emergency due to COVID-19, with a decrease in the number of cases and deaths only in the past weeks, but remaining in a very high level of transmission with concerning trends in some specific states. Up to July the 5th, Brazil has reported almost 19 million cases of COVID-19, with an average of more than 49,000 cases in the last 7 days. In total, more than 500,000 people have lost their lives in Brazil, with an average of more than 1,500 daily deaths during the last 7 days. Brazil has the capability and the expertise to lower transmission of COVID-19, protect the vulnerable, and to save lives. The country is known to have a very large capacity of vaccination in the context of its unified health system. Brazil has administered more than 105 million doses of COVID-19 vaccines, with more than 1.5 million during the last 24 hours. I'd like to note that PAHO is working directly with the 3 levels of organization of the health system in Brazil, with the municipal level, with the state level, and with the federal level. And PAHO is participating in local emergency committees and assisting the genomic surveillance network, among other activities. The main message of PAHO applies to all countries of the region. The strict implementation of public health measures and its close monitoring and fine-tuning, and the access to vaccines are key for the control of the pandemic. I hope I have answered the concerns of the journalist. Thank you.
Muchas gracias, doctor.
Thank you very much, Doctor. We have a number of other questions related to COVAX. And these are from Daniel Collins, TN24. And we also have a question from Rachel Nolt from Bahamas. Rachel asks,
to receive its first tranche of vaccine from COVAX this month. However, it was delayed to July. What has contributed to delays in supplies? Should countries in this position be concerned about further delays? Ivan Cairo in Suriname, in English, also this, so far Suriname has received 24,000 doses of vaccines through COVAX. When will the next batch for Suriname be available? Y en el mismo sentido, Daniel Collins de TN23 en Guatemala también pregunta cuándo podría...
And Daniel Collins asks, when will Guatemala be able to receive the vaccines that were donated by the US and that were presumably going to be distributed through the COVAX mechanism? Doctor?
Thank you for the questions. Primero, déjame un poco completar la...
Thank you for your questions. I'd like to complete the question posed by Guatemala. I thought I had answered this, but let me just underline that the decision to expand the number of people, or the decision as to whether we need to administer the second dose or to the most number or the highest number of people possible, as opposed to vaccinating more people with a single dose, each country needs to apply the strategy based on the reality that they face every day.
Not only the Bahamas, but the other 17 countries in our region are expecting to complete the third wave of deployments from COVAX. COVAX faced many serious limitations during the month of June due to different problems. We still have the government of India that is not allowing the Serum Institute of India to export the vaccines, the AstraZeneca vaccines that Serum Institute is producing. We had also a problem with a new site that the AstraZeneca producer applied to receive the EUL, the authorization for the emergency use listing from WHO. It was delayed. More than the producer expected. So June was we had the very important problems on the supply side. Now these countries, the revolving fund of PAHO is in negotiation with the producers to have the information about when the vaccines will be available to deploy these vaccines to them now in July. Now we expect that until next week we will receive this information and we will share with the countries. Second, we have also participated in many negotiations to facilitate the donation from the US government to the countries in the Caribbean. The US will donate 3 million doses. We are working with CARFA and the US government to facilitate the logistics that for these vaccines, but also the syringes and other supplies that the countries may need. Suriname is in a similar situation. I just want to slightly correct the number that was provided. Suriname received 52,800 vaccines and is still pending 26,400. This is to finalize the third wave. And it's important that the producers can accomplish with their contracts and can deploy the vaccines to COVAX so we can make this process to provide the vaccines to the countries as soon as possible. Sobre la pregunta de Guatemala, una aclaración.
Regarding to the question related to Guatemala, just a clarification. The U.S. is donating on two different channels. One is through the COVAX mechanism. The other one is through bilateral donations. In the case of Guatemala, the donation from the U.S. is bilateral. It's not through the COVAX system. So through this bilateral arrangement, PAHO is then asked to support with the logistics and other measures required for that process to take place. But because this is a bilateral arrangement with the US, we always need to take into account the quickest way to do things, because many times when a country already has a bilateral agreement with the country that will be sharing the vaccines, in this case, the US, it's easier to connect the manufacturer with the recipient country, and in this way, expedite the process of sharing these doses with that country. Now, the US also works through the COVAX mechanism, and in our region, we were the first region in the world that delivered vaccines to certain countries. We had more than 1.5 million doses that were delivered to Honduras. The same thing has been done for El Salvador. We also have some upcoming deliveries to Bolivia. And in other cases, our Madam Director mentioned what the current situation was in certain countries in terms of the delivery of these vaccines. So through the COVAX mechanism, we're working based on the experience that we've had previously, and we're trying to get these vaccines as soon as possible to all of these countries. And through these bilateral arrangements, we leverage all of the resources that we have available to expedite that process. Thank you. Thank you, Doctor. A follow-up question from Suriname.
PAHO with regards to the ongoing third wave, which resulted in hundreds of new cases every day and an increasing number of deaths, which put the medical system under immense pressure. Dr. Aldigueri?
Yes, thank you for this question from Suriname. PAHO has a country office in Suriname, and our country team is providing direct technical assistance regarding all pillars, the 10 pillars of a response, and since the very beginning of this pandemic, from public health measures, organizations of health services, surveillance, risk communication, and also very important procurement of strategic goods, including personal protection equipment and laboratory reagents. Regarding this peak of transmission that has been reported and characterized by the authorities in Suriname, during the last couple of weeks or more than weeks, I'd like to highlight two specific aspects of our technical assistance. First, in terms of management of critical patients in ICUs, we have been working directly with the reference hospitals in Paramaribo regarding the supply chain of oxygen This is a challenge that many countries of the region have faced during the last month with the new peaks of transmission and needs for more oxygen and rational use of oxygen. The second aspect that I'd like to flag of the PAHO direct technical assistance is regarding the expansion and the strengthening of the laboratory network with the introduction of antigen rapid tests, mostly to be used in the interior, interland of the country among indigenous and Afro-descendant populations. But also regarding the characterization of the variants, the transmission and community transmission of variants of concerns in the country. The country is closely linked also to partners as Holland and to universities. So we have been supporting the interpretation of characterization of the variant circulation in Suriname. I hope I have answered the question of the journalist. Thank you.
Gracias, doctor. Tenemos varias preguntas vinculadas.
Thank you, doctor. We have a number of questions linked to traveling. One of these questions is whether PAHO has an opinion on this European Union traveling passport and if this could lead to a complete avoidance of any transmission of the virus. Another question relates to traveling during the winter season, in which many people travel abroad, and whether or not this could complicate situations in different countries. Another question is whether or not some additional, more rigorous controls need to be placed on traveling to try to avoid the spread of these new variants across borders. Well, these are all very important questions. First and foremost, when people travel, be it domestically or abroad, this increases the risk of spreading COVID-19. And as countries renew and reopen access by reopening their borders and international travel, then this, within the context of the virus spread, needs to be assessed accordingly. And this needs to be subjected to a risk analysis process, both from the destination as well as the origin standpoint. In this sense, it would be necessary to prioritize the health and well-being of the communities in the country based on the competent authorities. Now, in this context, the recommendation from the WHO and PAHO has been to not require a vaccine certification or any kind of proof that people are vaccinated to allow the traveling to take place. Now, this has many reasons. One of them is that even people who are completely vaccinated still have a risk of becoming infected and also transmitting the disease. So a passport that verifies the vaccination or some form of proof can create a false sense of security, and this would instead use other more effective measures. On the other hand, there are many countries that don't have sufficient access to vaccines, and requiring this proof from travelers will simply expand this inequality between countries. Nevertheless, it's also necessary to remember that in many countries, there have been implementations of measures to restrict international travel. And due to the fact that these restrictions have been in place for a long time, there are some countries that are looking for alternative options to restrict these restrictions and focus them on certain populations. And so in the European Union, through their Green Pass concept, introduce a measure for selective application for certain groups of travelers. but they seek to apply these measures in an isolated way. And it's just a measure that is geared towards controlling certain aspects of the problem. It's not a catch-all measure that will resolve all the issues. In many cases, we've seen that some of these alternative measures can in fact lead to a more effective approach to these issues. This includes other measures such as proper hand washing and disinfection, using masks. All of these measures need to continue to be in place. Now, after having such a long period of confinement for so many people, not being able to travel for a variety of reasons, be it for tourism or business or what have you, people that need to travel need to ensure that they take the necessary precautions. And likewise, those countries that receive those travelers need to adjust their measures and need to be very vigilant and focus on early detection, perhaps isolating suspected or confirmed cases, placing people under quarantine conditions, and make sure that they conduct a proper monitoring for these cases. And this needs to be in place for a good amount of time still in order for us to achieve a proper balance between the risk and the opening of the economy and the fostering of well-being conditions for everybody. Thank you, Doctor. The next question comes from Mexico. Mr. Ochoa from Monterrey. And the question is that the Assistant Secretary of Health yesterday reported that Mexico has observed a third wave of COVID infections, and they ask what measures should be undertaken to face this third wave. And the other question is, how do you see this third wave that's occurring in Mexico?
Con la OPS su evaluación cuanto al inicio de un tercer pico de transmisión en el país. Durante los últimos
That's correct. The Health Secretariat in Mexico, along with the PAHO, has issued a notice that there's a third wave of COVID infections. We've seen a number of high rates, increasing rates in the Yucatan Peninsula states, some states in the south, and in the area of Mexico City. There was a federal government communication that was issued, and there were also a number of reinforcement measures for the public health mechanisms. And so in those states, there was a broad outreach campaign conducted. And this was particularly geared to younger adults who are more active in terms of the social dynamic in Mexico. I would also like to highlight the importance of strictly adhering to public health measures, especially in the tourism sector, and in particular, some of these facilities located in the states where these higher rates of infection have been detected. As I stated, these are in Baja California Sur, as well as in the Yucatan Peninsula area. That's where we're seeing the highest spikes in the infection rate. In this regard, I'd like to mention two other new issues related to the implementation of the vaccine process in Mexico. And that is that we need to broaden this vaccination effort to a broader age group, extending out to people as young as 29 years of age. This is an important element because many younger people have a key role to play in the disease's dynamic in country. And additionally, we need to involve other regulatory agencies in country with regard to the use of the Pfizer vaccine with younger people as young as 18 years of age. I think that I answered both questions that were made by the journalist as it pertains to Mexico. Thank you, Doctor. We have another question from Blanca Valadez from Milenio in Mexico, and she asks, What is the reason for, despite the fact that a person can have a first and second dose, or either a person can still get infected and in fact die? Thank you. People are very curious about the vaccines, which is a good thing, but I think that we need to always clarify that vaccines are the best tool that we have in terms of public health the world over. Vaccines can reduce the number of deaths, the number of cases of COVID-19, as we've seen throughout the course of the crisis, but there's no vaccine that has 100% effectiveness. So it's important, very important for vaccines at the individual level. These vaccines are geared towards protecting people at the individual level, and we've seen many studies that have corroborated this assertion. When people take these additional measures, they are more protected. When people take these vaccines, they are, in basic terms, preventing the most severe consequences that can be derived from the disease. Secondly, vaccines also offer a collective protection. So when you see determined level of vaccination, then we see that the vaccines do not just protect people individually, but it also ensures that transmission in those countries is reduced. And this could be at the national level or even at the city level. So what we're looking to do with this vaccine today is ensure individual protection for people, especially those in the most vulnerable groups. And there's no doubt as to the change that we've been able to bring about. When we look at the data, what's been happening in the region, the number of people that are in ICU units today are much lower than what we saw last year. The number of deaths has been reduced dramatically in many countries, especially among people that are 80 years of age or older. Why? Because they were the first ones to receive the vaccine. They took the first dose and subsequently then took the second dose. So these impacts have already occurred in all of these countries, and this allows us to broaden our coverage. And so we need to continue to engage in this vaccination effort to achieve approximately no less than 70% coverage for any country. So there's no doubt that vaccines offer important protections, but again, no vaccine is 100% effective. And that's why it's very important to understand that wherever you see transmission, even vaccinated people need to engage in the necessary protection measures, especially those that belong to the most vulnerable groups. People should not think that they have complete protection, especially if they have or they live in a city where there's a very high rate of infection. That person or those persons could be part of a very small group that will not be completely protected against the disease, even if they did go through the full vaccination protocol. So it's very important for people to take the vaccines, trust in the effectiveness and the safety of these vaccines, but until we get the infection rate properly controlled, they still need to engage in these personal protective measures to avoid any infection. Thank you. So we have other questions from Nicaragua, Nidia Lopez, and they basically ask if the increase in the infection rate in the country could be related to the presence of one of the variants of concern. The health ministry has issued some communiques that relate to the presence of the Delta variant in that country. What are the measures that need to be undertaken? Well, first and foremost, PAHO relies on the data that all the member states report. And these are data that we received in great detail. These are published in our website and in the various reports that we issue. And it even breaks down the information by nation, by cities, by region, etc. So we have right now In the case of Nicaragua, very little in the way of information. And so we haven't been able to conduct the necessary analysis to ascertain what's happening on the ground in Nicaragua. But there are other sources, non-official sources of information that indicate that there has been an uptick in the infection rate in certain areas. So in this regard, we want to reiterate that the Pan American Health Organization has been providing reagents and other compounds to that country so that Nicaragua can try to identify the variants that they are observing in country. In order to expand their surveillance efforts, they need to examine their protocols, their training procedures, their response procedures, etc. So far, what we've seen and what we've received in terms of information is that Nicaragua is still currently engaged in that process. And based on that, we hope to see some reported information from that country as to the number of variants that exist in country.
We are reaching the end of today's press briefing, and this question comes from Daniel Politi from the New York Times, and it says,
of the virus, do you think that the increase in vaccination in the Northern Hemisphere means that the region will continue to be the epicenter in the near future, or do you think that this may change? Doctora Etienne?
Thank you, Daniel, for that question, because that's exactly the risk that we are facing right now. If we don't ensure that countries in the South have the ability to vaccinate as much as countries in the North, this virus will keep circulating in the poorest nations for years to come. Hundreds of millions will remain at risk, while wealthier nations go back to normal. Obviously, this should not happen, and we know how to address it. First, we need global solidarity to minimize the wide disparity in access to vaccines between rich and poor countries, and between rich and poor within countries as well. COVAX has been struggling to access doses as virtually all supply currently available has already been purchased by high-income countries, delaying the delivery of vaccines. But donations like those pledged by the United States are helping to address these gaps and to mitigate these delays. In July, we expect that about 70% of COVAX deliveries to come from donations. And so we continue to thank those countries that are donating from their supplies of vaccines. And that is why we as PAHO will continue to reinforce that donations are the only way to get more doses to our region right now. So we urge countries with available doses to share them with countries in the Americas and to reduce the inequity that we face today. As I just mentioned earlier, PAHO is also looking at other ways in which we can use our revolving fund to help countries in the Americas access the vaccines that they need to stop the pandemic in the long run. But countries cannot afford to wait for vaccines to act. They must combine all the strategies that have proven effective against this virus. Public health measures such as mask wearing and social distancing will bring down transmission. And they are especially important as variants of concern circulate. Countries must also intensify surveillance and let this data inform their actions so that new cases can be brought under control in the quickest possible time. And of course, countries should be ready to roll out vaccines as quickly as they become available, starting with the most vulnerable. So thank you again for your interest, and thank you as a responsible media that you continue to spread the important news that countries need and people need to protect themselves and to be safe. Thank you very much.
Muchas gracias, doctora Etienne. Ahora sí, entonces hemos llegado al final.
Thank you very much, Dr. Etienne. We have reached the end of today's press briefing. Let me remind you that you can find further information on COVID-19 situation in the region of the Americas on PAHO's website, www.paho.org/coronavirus. Thank you again, and let us take care of ourselves. Greetings.